This recording is going to cover topographical anatomy. As we learned in Learning Unit 1, topographical anatomy, or surface anatomy, is the study of the structure of the body with emphasis on superficial landmarks. This includes anatomical guides, linear guides, and anatomical limits. You might be asking yourselves why we need to study this, and the answer is quite simple. Imagine you've never been in the preparation or embalming room before, and the owner of the funeral home hands you a scalpel and says, "Make an incision and raise the common carotid artery." What would you do besides yell for help? How could you possibly embalm without knowing where these vessels are? An embalmer utilizes many skills, but knowing how to raise an artery is essential, as well as knowing which vein to use for drainage. By the time you finish your studies, you will have no problems with this. In the meantime, it's essential that you possess a thorough foundation and understanding of the blood vascular system and anatomy of the human bodies so that you will be able to embalm and solve problems. Again, topographical anatomy or surface anatomy is the study of the structure of the body with emphasis on superficial landmarks such as the anatomical guides, linear guides, and anatomical limits. Anatomical guide. This is a method of locating a structure, such as an artery or vein, by reference to an adjacent, known, or prominent structure. Anatomical limit, or anatomical extent, is the point of origin and point of termination of a structure in relation to adjacent structures. Simply put, where it begins and where it ends. Linear guide is a line drawn or visualized on the surface of the skin to represent the approximate location of some deeper lying structure. Selected topographical areas. The anterior cervical triangle. This is located in the anterior portion of the neck. It has three sides, boundaries, or border. The superior boundary, or the base, is formed by the inferior border of the mandible. The lateral boundary, or border, is formed by the sternocleidomastoid muscle, or simply SCM muscle. The medial boundary is formed by the midline of the neck. The major contents of the anterior cervical triangle are the common carotid artery. This lies medial and deep to the internal jugular vein. The internal jugular vein lies lateral and superficial to the common carotid artery. And the vagus nerve lies posterior and in between the artery and the vein. These three vessels are bundled in the carotid sheath, which arises from the deep cervical fascia. So let's talk about the boundaries. It might sound strange and confusing that the superior border is formed by the inferior border of another structure. However, we must take the superior part of the triangle and the mandible, or your lower jaw, as two separate items. Let's take the mandible by itself. I want you to visualize this on yourself. The part of the mandible that holds your lower set of teeth is the superior part of the mandible. The jawline is the inferior part of the mandible and is closest to the neck. To get general location of these boundaries, I want you to try this exercise on yourself. Take your index finger and place it just under the middle of your chin. Now trace an imaginary line all the way down your neck until you come to a hollow or slight depression at your breastbone, which is known as your sternum. This depression or indentation is called the jugular notch of the sternum. The line that you just drew is the midline of the neck. This is the medial border of the anterior cervical triangle. Now take that same finger and place it on the inferior part of your lower jawbone, the mandible. That's the superior border of the anterior cervical triangle. And finally, take your finger and place it behind your ear, and it doesn't matter which side. Do you feel a bump? That's the mastoid process of the temporal bone. Now run your finger obliquely towards where your breastbone meets your collarbone, which is your clavicle. This is called the sternoclavicular articulation. From the bump of your ear to the sternoclavicular articulation is where you find the sternocleidomastoid muscle, the SCM muscle. This makes the lateral boundary of the anterior cervical triangle. Be aware, instead of the word contents, you will see the following: contained or housed within. For example, we can say, what does the anterior cervical triangle house? What is contained within the anterior cervical triangle? Name the contents of the anterior cervical triangle. And the anterior cervical triangle houses. These are just different ways of asking for the same question. And the answer to all of those would be the common carotid artery, internal jugular vein, and vagus nerve. The axilla or axillary space. The axilla is a small hollow beneath the arm where it joins the body at the shoulders. It's what we refer to as our armpit. It contains the following structures. The axillary artery. This lies lateral and deep to the axillary vein. The axillary vein lies medial and superficial to the axillary artery. And the brachial plexus. This is a network of nerve fibers that originate from the ventral branches of the last four cervical, that's C5 through C8, and the first thoracic or T1 spinal nerves. This network supplies the shoulders, arms, and chest. Unlike the anterior cervical triangle, we're not going to be concerned with the borders of this region. We will only be looking at its contents. The boundaries will be covered in embalming too. The femoral triangle or Scarpa's triangle is located in the anterior superior portion of the upper 1/3 of the thigh. It has three borders or boundaries, and they are as follows. The superior boundary or the base of the femoral triangle is formed by the inguinal ligament. The lateral boundary is formed by the sartorius muscle, and the medial boundary is formed by the adductor longus muscle. It's going to contain the following vessels or structures. The femoral vein, this lies medial and deep to the femoral artery. The femoral artery, which lies lateral and superficial to the femoral vein. And the femoral nerve. We don't really need to know the location of this. But here's a little help to remember the contents of the femoral triangle, and this only works in the femoral triangle when you go medial to lateral. Just think of this VAN, V-A-N. The V stands for vein, A for artery, and N for nerve. So the vein is a medial vessel, the artery is the lateral vessel, and the nerve is still lateral.